All right, this is the fun part where we just ask questions. I'm gonna take out my jacket, guys. So if you want to do the same thing, it's a little hot. All right. Now here's how this is going to work. There are really no rules. We haven't asked. There's no pre-programmed questions. All you have to do is, first of all, everybody should sit down. The second thing is, I'm just going to call on as many people as we can during the time that we have. And I'm going to, just to make sure it's fair, I'm going to call on girl, boy, girl, boy. So just raise your hand if you've got a question. Try to keep the question relatively brief. I'll try to keep my answer relatively brief. And we'll try to get through as many as we can. And introduce yourself if you don't mind. There are people in the audience with mics. And so if you can wait for the microphone so you can introduce yourself and then ask the question so that everybody can hear you. Okay? All right. This young lady right there in the colorful blouse right there. That's you. Colorful dress.
Hello.
Hello.
Good afternoon, Mr. President. Thank you for taking my question. My name is Norma Goodman. My question regarding health care is twofold. It appears that your plan has the healthcare industry funding your healthcare reform. And I think you just alluded to that a little. It poses a concern for me. I'm the owner of a Medicare certified home care agency. And by the way, my agency wanted to invite you to come on a home visit with us. But your proposed budget includes drastic cuts to reimbursement. I feel that threatens the... You're shaking your head no?
Yeah, I don't think so. I should point out, if I'm not mistaken, that the home care industry has actually endorsed this reform effort and are moving forward. But go ahead and finish your question.
Well, that is my concern, that your budget proposal has lined up from MedPAC's recommendations, several cuts for the next several years that will amount to, I don't know, $13 billion or something like that over the next few years.
Okay.
So,
well, let me just respond. The MedPAC idea is to have healthcare experts and doctors sit down and figure out how can we improve Medicare? How can we make it more cost efficient? It is not an exercise in just cutting reimbursement rates. In fact, in some cases, we may need higher reimbursement rates for certain aspects. I actually think home care ends up being cost efficient in many cases.
thank you.
Rather than institutional care, and it helps keep people in their homes. In rural communities, there are certain areas where doctors aren't reimbursed at an adequate level, and so you're seeing too many doctors leave those communities.
Right.
So what we do want to make sure of, though, is that we are, in our reimbursement systems, we're incentivizing smart things. So, for example, right now, if a hospital is reimbursed for the number of tests that it does, then that may not give them much of an incentive to make their system more efficient, so that once you take that first test and you've gone to the hospital, then you end up having that test sent around to everybody so you don't have to take 5 more tests. But right now, the way the reimbursement system is set up, you don't have that incentive to just have the one test and then use information technology to distribute it throughout the system. So those are the kinds of changes that we want to make. We think that the more that we're encouraging efficient, smart care, that's going to be good for providers, that's going to be good for patients, that actually frees up more money so that we, in some cases, can provide higher reimbursements for folks who right now are not getting sufficient reimbursement. It's a matter of using the dollars that we're spending more wisely than we're spending them right now. Okay? All right.
Thank you.
Thank you.